So, welcome to the Wellness Health Services Health Talks. My name is Dr. Dirito, family physician working in the Machakos region. Our health talk this morning is based on major depression. Remember that this health talk does not replace your seeking appropriate health advice. This is meant for general information. So depression is a health condition which is characterized by low moods, and it affects about 300 million people worldwide. So it's a major cause of morbidity and mortality in the healthcare system. It affects women more than men. About 20% of the people with depressions are females, and 12% of the people affected by depression are males. People between the ages of 25 and 44 years are the biggest sufferers of this condition, but it is also distributed among all the age groups, from adolescents, middle-aged people, and to the elderly. The cause of depression is unknown, but there are factors that are known to contribute. One of the things is genetic factors. You find that people who come from families which have been affected by depression have 3 times more likelihood of being affected by depression. There are biological factors, the biggest being the neurotransmitters in the brain. There are 3 major neurotransmitters in the brain that have an impact on depression. One is serotonin, dopamine, and norepinephrine. And you find that the drugs that are used to control or to treat depression try to regulate the levels of these 3 neurotransmitters. So we have also environmental factors which have an impact on an individual getting depressed. Major environmental triggers like death of a loved one, sexual abuse of an individual, significant distress in life. These act as triggers. So there are various subtypes of depression. You have postpartum depression, which usually comes around the delivery of a child, and it can also occur after delivery of a child or before delivery. We have major depression coming after as a result of lifestyle changes. Then we have atypical depression, whereby you have various trigger factors, and then we have the depression that occurs after several trigger episodes, but then it persists even after the triggers have gone away. So you have recurrences. So for you to be diagnosed that you have depression, you have to have persistence of symptoms of depression, which are about 9 of them for a period of more than 2 weeks. These include persistent depressed mood. You are feeling in low moods, nothing seems to be exciting to you, and then you have an inability to feel pressure for anything. You may have weight gain or weight loss, and also you may have decreased appetite or increased appetite. We have insomnia, which is lack of sleep. You can have sleep that you don't get into sleep easily, or you lose sleep in between, or you wake up unnecessarily very early, not because you want to, but because you have no sleep. Then you can also have hypersomnia, which is excessive sleep. You have no energy to wake up. Then you have fatigue or loss of energy. Activities that you are used to take more than necessary effort to do them. Then there is a feeling of worthlessness. So you don't feel important. You have no motivation for anything. Then loss of self-esteem. You feel worthless. Difficult thinking or concentrating. So you feel there is a feeling of you are overwhelmed. Your brain is unable to conceptualize things that are usually normally easy to do for you. Then poor memory, and then last of all, you have recurrent suicidal ideation. So you may plan have specific suicidal ideation, or you feel that you feel like you want to take your life to sort out the difficulties that you are facing in life. So for the treatment of, for you to be diagnosed, before we go to the treatment of depression, there has to be persistence of these symptoms for more than 2 weeks, and the presence of 5 of them at any given time would classify you as having depression. Treatment is mainly pharmacological and non-pharmacological. Non-pharmacological, where this is where there is no medication that is used. And one of the things that has been shown to relieve episodes of depression is physical activities. Having regular exercises, approximately 20 minutes or more for 3 times per week, helps to relieve depression. So if you are feeling in low mood, just taking an exercise program could be a way of helping your depression. Diet, especially taking healthy foods with more vegetables and fruits, these help to relieve the symptoms of depression. Then we have psychotherapy. Like psychotherapy, this is where you talk to a health practitioner. We have psychologists, we have nurse psychologists who are well trained in giving patients counseling and listening to patients. The commonest treatment modality is something we call cognitive behavior therapy. This is a form of counseling where the counselor helps you to cope up with the difficult life stress situation. Because basically for you to get depressed, it's an inability to cope with difficult life situations. Then we, of course, we have the pharmacological treatment where we have drugs that we call antidepressants, which are used and they help to, as I said, there are various classes that are used of antidepressants. The commonest are selective serotonin reuptake inhibitors, drugs like fluoxetine, the commonest one. We have anticyclic depressants, and there are other newer classes of antidepressants which are usually prescribed by health practitioners. And then there is what we call ECT, or electrical current stimulation. This is where a patient's symptoms are resistant to the 2 other modalities, and then the individual has to be taken through an electrical excitation to try to relieve the symptoms of the depression. So it's like causing a seizure-like activity in an individual, and this has been shown to help with the depression. So in summary, depression is a medical condition which affects females more than males. It's a common mental health problem which affects about 3 million people worldwide. It's commonest among people of middle age, between 25 and 44 years. For you to be diagnosed with depression, there has to be persistence of 5 or more of the common symptoms of depression. Treatment is non-pharmacological, which include exercise, psychotherapy, and then there is pharmacological treatment where there is use of antidepressants, and then electrical conversion to try to relieve severe symptoms of depression. Thank you very much for listening to me, and I encourage you to subscribe to our website and our YouTube channel so that you can continue getting these health talks.